Hello everyone, a very happy new year to all of you. This is Dr. Aditya Gupta. I wanted to make this video around 1 or 2 weeks earlier, but couldn't get time for it. But here it is. For anyone who's preparing for NEET PG 2025, what should be your strategy? How to prepare for NEET PG 2025 in the next coming five and a half months. All right. So the first thing that I really want to tell you guys is, which I always tell in all my videos, is you're not preparing for the exam. You're preparing to be able to revise in the last 7 to 10 days before the exams. And how you go about doing that last 7 to 10 day revision will determine how better your rank is. All right. The better the last 7 to 10 day revision, the better would be your recollectability of facts. The better would be your attempt of the MCQs on the actual exam day. Better would be your confidence. And that would actually give you a huge boost to the rank. Alright, so again, I'll re-emphasize this. Always keep this in mind. You're preparing not for the exam, you're preparing to be able to revise in the last 7 to 10 days before the exam. With that, let's start with a broad strategy. There are certain minor points also, which I'll cover in other videos over the next 1 week that I'll be recording. But let's start with what's going to be the broad strategy. See, the broad strategy is concise, precise, revise. You have broad syllabus, you concise it down. The concise syllabus should be precise. Precise means it should be high yield. It should be from the topics which are asked again and again. That is your previous year topics. And then revise, that you do a proper 3 to 4 revisions of these topics so that in the exam you're able to perform well. So the broad strategy is that the first read or the revision, whatever you want to call it actually, should be from, although we are starting in January right now, from January, February to mid-March. Around, on the higher side, maybe if not mid-March, maybe towards the end of March. You can give around 100 days. I know a lot of you would have started in December, so you can adjust accordingly. You can give broadly 100 days to the first read. Now, what is the goal of this first read? There are two goals of this first read. Remember, the goal of the first read is that in the first read, you can read broad. You can read more. You have 100 days to read. So you can read a lot. But simultaneously, and this is a very important word I'm telling you, simultaneously, side by side, you should create your concise material. Okay, side by side, the creation of the concise material should be there, because when in April you start your revision, it should not happen that now you're revising and you're like, oh, this is so huge, I cannot revise. No, that should not happen. And 90% of you will make this mistake, that in the first read, you will go broad, you will be able to read, you will solve your MCQs, you'll solve your QBank, you'll solve your PYQs. But when it comes to revision, suddenly you'll be like, I can't revise this, what to do now? And then you will be stuck between a rock and a hard place, right? So you don't want that to happen. That's why the goal of the first read over the next 100 days, anyone who's starting today or anyone who started in last week, the goal in the first 100 days is to read, yes, but simultaneously, daily, 1.5 hour, 2 hours, you should give to preparation of the concise material from whatever you have done in that particular thing. Along with that, doing your first pass of previous year question. If right now you're not doing QBank, that's perfectly fine, but the PYQs should be thorough. Why PYQs and why PYTs? Because preparation of concise material depends upon this, knowing the important previous year topic. So if you read 10 pages and you understand that, okay, from these 10 pages, 2-3 pages were not that important because they have not been asked in the past 5 to 7 years, or they are seemingly very tough, and that's why they have not been asked in the past 5 to 7 years, then you know that you can create a 50% material from those particular 10 pages. To know what to create those concise materials, that first pass of PYQs is very important. Alright, so what can be a broad strategy for everyone? I would say for major subjects, that is your surgery, obs, gynae, PSM and path, give 35 days, around 7 to 10 days on these subjects. Alright, 7 to 10 days. So 7 into 4 is 28 days, 10 into 4 is 40 days. Around 30-35 days you can give to these major subjects. Alright. See, I've not kept medicine here, and I'll tell you why I've not kept medicine here. Okay. Then for the minor subjects, ortho, ENT, opthal, forensic, psychiatry, anesthesia, around 3 to 4 days on an average. So 6 into 3 is around 18, so around 20 days for these subjects. And for the medium subjects, that is your first and second prof subjects, your pharma, micro, biochem, you can get 4 to 5 days, so another 25 days. Overall, this will come around to be around 75-80 days, and another 10-15 days for the buffer, because for every subject I'm pretty sure you'll take one more extra day. So in a sense, you should complete the first reading of these topics, of the important topics, and along with that, the preparation of the concise material, along with that, in this first 100 days. After this 100 days comes the most important part, that is your revision. After these 100 days comes your most important part, that is your revision. Now, how do you make these concise notes? I'll make a separate video for that, how to actually make concise notes, but there are actually two ways people go about it. One way is that you read the main notes, which are given with your apps. Any app, doesn't matter. Can be DBMC1, can be Marrow, can be PrepLadder, that doesn't really matter. Now people do what they do, they watch the videos, they see the notes, alright, and then they do the previous year question. From the previous year question, they understand the important topics and they create their own concise revisable notes. This is the tough way to do it, but this is the better way to do it. Always remember that this thing is what I call as the trimming down method. This is what I call as the trimming down method, that you had the bulked up material and you trimmed it down to concise revisable material. Another thing a lot of people do is, which is a perfectly valid method, is bulk it up. That they start with something which is very rapid revisioning. All right, so you start with what? Initially you start with rapid revision. You do the rapid revision videos, you see the rapid revision notes, and then you solve previous year questions, and then you solve important topic modules, and from the explanation of those previous year questions and those explanation of those important topic modules, you add material. See, in both the cases, the goal is to get to something which is midline. Either you can trim it down, either you can start with a bulked up material or trim it down to something which is revisable for the second and the third revision, or you can start with something which is very small and hence a little bit inadequate, and you can add previous year question, you can add important topic module and get to the midline. Both the things work. All right. So I would say the trimming down method, that you start with bulky reading and then go down to the concise material, it is better for the major subjects. For example, obs-gynae surgery, I would actually advise you to do them a little bit more thoroughly, because these are rank determining subjects. If you don't know them properly, you won't even get a rank. All right. And for the minor subjects, maybe ortho, ENT, you can do the rapid revision plus the previous year question. Even for pediatrics, for example, if you want to see my videos for that matter, rapid revision plus PYQs, you will be able to get 70 to 80% of the MCQs correct. All right. So how do you concise it? Let's say there are 700, 800 pages of obs-gynae. You did the previous year question. You understood the concept. You don't need to know the concepts in your notes. Notes should be of high yield facts, things which you forget. So the important previous year topics and facts without any concept, because you have understood the concepts right now, in a shorthand, you have written it down and you concise these 700 pages to around let's say 300 pages, around 300 pages. All right. If someone asks me, sir, आप मेरे को ना एक important topics की list दे दो, मैं मार दूंगा तुम लोगों को. भाई मेहनत करो, work hard, yourself do the previous year topics and understand and get a feel what an actual exam is. ये करके चले जाओ, ये करके ना जाओ, तो भाई फिर तो हो गया. Then no one is going to crack the exam. No, do that effort yourself. So what should your day look like? Your day should look like that you read the notes for 2-3 hours. You solve the previous year question over 1.5 hour or half an hour for that matter. And from that, another 1 hour, you are making your concise notes. So if you're studying for an 8 hours on a daily basis, and I expect everyone to study at least for 7 to 8 hours on a daily basis, the first 3 to 4 hours, you solve you did your notes, you did the previous year questions, you understood the important topics from the previous year question, and then 1.5 hour, you made the concise notes. Like I said, a more in-depth video about how to concise notes is going to follow. After you're done with the subjects, let's say you did 3 days for a subjects, then afterwards, apart from previous year question, you can solve important topic modules, you can do a subject-wise test. That's about it. No more question practice is required. And more importantly, don't target 100%. You are not becoming a pediatrician, you're not becoming a surgeon in these 7-8 days. Right? If you're getting 80% above MCQs correct, all right, I would say if you're getting 75% also MCQs correct, move ahead. If you are getting to 75% MCQs, or if you're even getting to, let's say, 85 to 90th centile, because some MCQs can be very tough. If you're getting to 85th to 90th centile, 75% MCQ correct, move ahead. See, we're trying to become jack of all trade, not master of none. All right, you're not becoming a specialist in the 7 days. You should have good knowledge about every subject rather than being a master in one subject, because exam is not of one subject, exam is of 19 subjects. All right, so this is the actual hard part. Till March mid or till March end is the actual hard part, that daily you're going to study for 8 hours, 4 to 5 hours you're going to study, 1 to 2 hours you're going to do MCQ practice, and 2 to 3 hours you're going to do note making. All right, so this is the actual hard part that you have to do. Afterwards, what happens when you're done with 10 subjects, start giving GTs every 2 to 3 weeks. How to give GTs, how to review GTs, what is the importance of GTs, another video, I'll come, don't worry. Afterwards, so December to March, mid-March, or let's say even till mid-April, this is the part of doing theory, first pass of MCQs, making your concise notes. Afterwards, like a horse, यहाँ पे वो बंदा होता है ना horse का, सिर्फ straight ahead. The only thing you have to do is these concise notes again and again and again and again and again and again. जितनी बार करोगे उतनी ज़्यादा rememberability, उतनी ज़्यादा recallability, and उतने better तुम्हारे MCQs लगेंगे, and the better would be your rank in the actual exam. This is the time. Post April, May, June is the time to not get in FOMO. You should not get in FOMO at this point of time. You have done your notes. You have gotten the concepts right. Even if you're getting 70 to 80% concepts right, that's perfectly fine. You've gotten your notes. Now revise these notes again and again. Now don't get in FOMO. Oh, he's doing that. Oh, he's doing that. Nahi, ye sab bakwas nahi karni. Don't get into that. Now you're done with your concise notes, and now the time is for revision. I would say for those who are targeting NEET PG, if you're not targeting INI-CT is slightly, you can make it a little shorter. Okay, from mid-March, end March to mid-May, one revision, then May to mid-June, another revision, and then one final 10-day revision. If you're able to do these 3 revisions on top of the first 3 that you're doing, you're golden. 4 revisions are more than enough. All right. Remember, the revision of the notes should be fast, and during this revision, now you have to also start a lot of practice. Now comes the importance of practice. Now the GT frequency should increase. Now you should solve more and more previous questions again and again, and important topic modules again and again. Now the importance of question solving comes, so that on the actual exam day you are able to solve. First half you're given to proper theory and making your notes. The second half is for revision and practice. So concise, precise, revise. The first 3 months is for concising. The next 3 months are for precising and revising. That is solving your previous. Precise is what? Practice also, and revising is again revising those notes again and again. Remember, the revision with notes should be fast. You should just go through them, skim them. Okay, I know this. Oh, I don't know this. Remember it. I know this. I don't remember it. Okay. Repeat. Do the second pass of previous question and do important topic modules from your Q banks if you have not done earlier. If not done earlier, definitely now do route. And now definitely GT should be given every 2 weeks. Now a grant test should be given every 2 weeks. All right. And then finally, last 10 days only revision. In the last 10 days, there is no need for PYQs. There is no need for MCQs. There's no need for GTs also for a lot of people, right? Just revise these concise notes again. You have already revised them twice. The third time I hope you will be able to do it in the last 10 days. Now I'll be coming up with other set of videos on how to make proper notes, or how to concise these notes. Like I said, I'm concising these notes, how to concise these notes, or how to bulk up your rapid revision. All right. Both the strategies can be followed. All right. Which notes to use, whether to use main notes or whether to use rapid revision notes. I would say it's for the major subjects. That is your surgery, obs gynae, path and PSM. At least for them, do the main notes. For the rest, you can actually use rapid revision notes plus the bulking up. What should be the strategy to solve previous year question? How to use first aid. Like I said, in this video, I have not talked about first aid. First aid is a game changer when it comes to revision. And I'll talk about it again. I've made a lot of videos in the past, but again, I'll talk about it. What should be the strategy for INI-CT specifically? What should be the last 10-day revision strategy, and how to stay motivated? These are the other videos which I'll come up in the coming week. In this week, I'll again make this video. This is a broad strategy video on how you should go about your preparation till the June end. Till the June end, or June 15th or June 20th, whenever the actual exam occurs. All right. I hope you enjoyed the videos. If you have any other further doubts, please write it down in the comment section. Do let me know. Again, a happy new year to all of you. And I hope that every one of you gets your desired college and your desired branch. Thank you.